Well, as the Biden administration's mishandling of the southern border continues, immigration experts now peg the total number of illegal immigrants within the United States somewhere around 16, 17 million. Now, that's on top of what was already here before the Biden administration opened the floodgates. Now, a report from the Federation of American Immigration Reform finds that taxpayers spend approximately $182 billion to cover the cost incurred from illegal immigrants at the federal, state, and local levels. Now, those pushing for open borders often speak of, well, the taxes are being paid by illegal immigrants, but that number is estimated to be a mere $32 billion in taxes to offset the staggering expenses. Now, clearly, those taxes paid, primarily sales taxes, are not satisfying the mayors of sanctuary cities like New York who want the federal government to bail them out. Well, joining you now to help better understand these numbers is Ira Mehlman, media director at the Federation for American Immigration Reform. Ira, welcome to Washington Watch. Good to see you.
Thanks very much.
So tell us about the benefits. All right, let me give you a scenario. Someone crosses the border illegally into the United States. They're detained, then they're released. Are they on their own? What services, government services, resources are made available to them?
Well, there are all sorts of services, and I think we can point now to New York City as a prime example of what happens once people get to the United States illegally. The city is on the hook for providing housing for everybody who shows up. Any child who is in this country is entitled to a taxpayer-funded K through 12 education. We are a decent humanitarian people. We're not going to allow people with medical needs to go untreated. People use basic services, sanitation, all of those things. This costs a lot of money. These are not accounted for when people talk about the fact that, they're not getting direct welfare benefits in many cases. Some of them are, but most of them are not. But it doesn't matter whether you're getting direct welfare benefits. Just the societal costs of having you here amount to huge amounts of money. Recently, a councilwoman in New York City said that New York is now spending more on care of the migrants than they are spending on police, fire, and sanitation combined. $12 billion that they budgeted between now and the end of 2025. That is a staggering amount of money.
So you talk about welfare benefits, and I do think that if an illegal couple that are any illegal that's here that has children born in the United States, that child then is can get welfare benefits. So that's provided. Yes. But my daughter's an ER nurse. And I know that, as you mentioned, health care, we have a law here. You have to, anybody comes into an ER and you've got to help them. And that's a part of who we are as Americans. But about 1/5 of the uninsured population are illegal immigrants that are in this country. I mean, that's putting a strain on our health care system, is it not?
It is. It's putting a strain on our healthcare system. And by the way, we are paying for it in myriad different ways. In many cases, they'll go to public hospitals, which is paid for by the taxpayers. But even those of us who have private health insurance, the hospitals eat part of the cost, but a lot of it they're passing along to the insured patients. So our premiums are going up. I think anybody who has private health insurance knows that the price keeps going up year after year. Part of that is driven by the fact that we, as insured patients, subsidize those people who are not insured. And as you point out, a growing number of those people are in the country illegally.
Now, some states like California are actually providing a lot more services and cash benefits to illegals. But isn't a lot of that being offset by federal funds?
They are deciding on their own. Under the Affordable Care Act, illegal aliens were not eligible for taxpayer-subsidized health insurance programs, and that was deliberate. When they negotiated that bill back in 2010, that was a deliberate omission. They said illegal aliens are not going to be eligible. Now you have states like California, which, by the way, are facing huge budget deficits of their own, deciding that they are going to use state taxpayer money in order to subsidize health care for illegal illegal aliens. So, again, this is money that the state doesn't have to begin with. Number two, it is money that could be used for other services that American citizens and legal residents need. Instead, it is now going to subsidize health care insurance for people who are in the country illegally.
Ira, if I'm not mistaken, in the bill that the Biden administration was pushing for, the supplemental that included some border, I say border, it was immigration issues, was to give money back to some of these states that are struggling with the immigration issue, some of these sanctuary cities like New York City that are looking to the federal government to bail them out because of their leftist policies.
Right. That's exactly the problem here. You have these self-induced crises. And by the way, the Biden administration isn't mishandling the border immigration. They are doing this deliberately. And you are seeing these state and local governments doing precisely the same things. They are creating situations where they attract people who are in the country illegally, and then they turn around and ask everybody else to bail them out. Whether the money is coming out of state or local coffers or it's coming from the federal government, it's still the people's money. It's our hard-earned dollars that we send in taxes to the governments at various levels of government. They're supposed to be providing services for us. Instead, they're taking this money and creating new magnets for people to come here and abuse the system.
So, final question for you, Ira. We're up against a break. What is that price tag? Do we have an idea of what that total price tag is for the taxpayers here in America?
Well, as of last year, and by the way, there's been a considerable number of people who've come in since a year ago. We pegged it at about $151 billion. That's the net cost. As you pointed out earlier, it's $182 billion gross. But if you subtract the taxes that are paid, whether they're working on bogus Social Security numbers and the government's just collecting it, or it's sales taxes, it's still a considerable amount of money. $151 billion. That's a lot of money. Even in these days, is real money.
Well, when we're talking about sending, $60 billion over to Ukraine, let's shut off the border. We might have a little extra money to work with. Ira, thanks so much for joining us. Appreciate the insight.
Pleasure. Thank you.